In a heart study research done over 35 years, there was autopsies done or performed on children that after accidental death. These studies have found plaque in hearts and arteries of children as young as 7 to 9 years old. This shows that healthy eating is essential at all stages of life, not just after health problems occur. Children that are obese have a much higher chance of being obese as adults. Which raises their chances of many diseases such as heart disease, diabetes, and some cancers. The National Center of Health reported that in children ages 6 to 19, the percentage of obesity went from 6% in 1976 to 17% in 2006. Almost 20% of school-aged children are obese. My proposition is that we are failing to teach our children how to eat properly. My first supporting idea is to back my proposition is that obesity in children is on a rise as of the last couple of decades. My second supportive point is that there is a drastic rise of obesity and heart disease in young people today. The third supportive fact is that environmental factors play a large part in the poor diets of children. Parents are enabling their children and adding to the obesity epidemic in the process. Nearly 1 in 5 children are considered obese. Barlow, SE, and an expert committee says overweight is defined as a BMI of or at 85 percentile or lower than the 95 percentile for children of the same age and sex. Obesity is defined as a BMI at or above the 95 percentile for children of the same sex and age. Obesity can cause many health risks such as sleep apnea, asthma, joint problems, gallstones, liver disease, and many others. Obese parents usually create obese children. As children, we mimic what we see our parents do. If our parents have healthy eating habits, then that gives the children healthier eating habits. But if we see our parents eat poorly or large uneaten portions, then the children will do the same. The Mayo Clinic states that that type 2 diabetes occurs when resistance to insulin happens or when the pancreas stops making insulin. The exact reason for this is unknown, and there are definite factors. These factors are genetics and environmental factors caused by weight gain or not enough exercise. Weight gain is caused by improper diet and incorrect food portioning. If parents were properly educated on size and content of their children's diet, there would be less cases of type 2 diabetes. A leading cause of death is heart disease. Improper eating causes high blood pressure, hypertension, and other heart diseases that may lead to heart attacks. The CDC states in a population-based sample of 5-year-olds to 17-year-olds, 70% of youth had a high risk of at least one cardiovascular disease. Many cases of heart disease and type 2 diabetes can be avoided if we simply educate ourselves and our younger generations. One of the reasons the obesity rate has gone up so high in the last couple of decades is because of eating habits of these children's parents. Eating habits are created in childhood. This means parents pass on their poor traits of unhealthy eating. It creates many health risks for children who will eventually pass those on to the next generation. Proper education is one way to prevent obesity in children. The CDC states that dietary and physical activity behaviors of children and adolescents are influenced by many sectors of society, including families, communities, schools, child care settings, medical care providers, faith-based institutions, government agencies, the media, the food and beverage industry, entertainment industry. If a toddler as young as 2 is obese, they have already raised their risks of being obese as adults. In summary, there are a lot of ways to educate and avoid obesity, type 2 diabetes, heart disease, and passing on improper information of healthy diet. We are able to change the outcome of the future by providing correct eating habits for our children and upcoming generations. Parents need to educate themselves to give their children and future generations a fighting chance against obesity and diseases. Thank you.
Emily, the opening material I think is a little complicated. You've got this stuff about plaque and the autopsies of children, and it introduces a subject in a very sideways manner. It sounds like you're going off on a tangent. When you finally get to the proposition, your argument suddenly sounds a lot clearer, and I think the opening material that you have doesn't really lead to the proposition that you're talking about. There's not really much doubt that people's poor eating habits are bad for them, so that's not where the controversy is. The controversy concerns why they have these poor eating habits, and you're willing to put the blame on the parents, at least at the beginning of the speech, and I think that's fine. That should be your argument, that like you said at one point, that the parents are not properly educated, or our failure to educate parents properly that's leading to this particular problem. I think that would be a reasonable argument. Now, where's the evidence that says that the parents don't know what to feed their kids? Is it because they are ignorant, or is it because some other reason that they feed the kids the way they do? There's one point toward the end of the speech where you're talking about everybody who has to share responsibility for this, and it's a long list of people who are part of this, and all of a sudden I'm going, well, then where's the argument? Everybody's got a finger in this particular pie. Perhaps that's the wrong way to express it, that everybody's got their finger in the pie. But actually, I think that's a pretty good way of expressing it. It fits really well. So all of a sudden, there's not really that argument that you were making before that it's one particular group of people that we could fix this. I need to see some evidence that says educating people would make a difference. A lot of people understand things, that doesn't change their behavior. And I think that's one of the problems that we're faced with. Why is it that people are behaving the way they do? I'm not quite sure. I didn't think the secondary structure was as clear as it should be. When you get to the body of the speech, it really feels like you're just kind of wandering around on the topic. Again, there's a lot of data here about type 2 diabetes. At one point, for instance, there's a claim that says it's the responsibility of the parents, or the parents are the ones who are responsible for this, or they're causing it. And then the proof that you offer has got something to do with type 2 diabetes, and I'm wondering, why is that information connected to the earlier point? That, I think, is a little bit problematic. So I don't think anybody doubts that there's a problem with the way kids eat nowadays. The question is, why is it that way? And you need to build the argument a little bit more in a focused manner. I think it stays kind of generic, and there's a lot of reading that's going on. I haven't said anything about it before, and I don't want to embarrass anybody or sound like a scold, but I noticed several people are on their electronic devices at the time that I'm talking here, and I find it distracting when I'm talking to other people, and I look up and I see that there are people who aren't paying attention. 85% of you will learn more from listening to my comments about other people's speeches than you'll learn from anything that I write down on your piece of paper. So I would appreciate if you would be attentive to what I'm saying. And I have not looked to see what people are doing while your classmates are speaking, but I'm thinking about doing that. And if I find that people are not paying attention to their classmates, that's going to be a problem for me. So let's, like I said, shut this stuff down for the most part. We're down to our last speaker for the evening, so we're a little late in this process. But let's remember this for the next speeches, okay, everybody? Because, like I said, I don't want to be a nag and a scold, but there's just some places that we have to draw a line, and I'm going to do it there. Thank you.